What is the most common underlying mechanism of paroxysmal supraventricular tachycardia, PSVT? A. Automaticity. B. Triggered activity. C. Reentry. D. Enhanced conduction. Answer: C. Reentry. Explanation: the most common underlying mechanism of PSVT is reentry, which involves a circular pathway of electrical conduction within the heart that allows the rapid re-excitation of cardiac tissue, leading to tachycardia. Which of the following is a characteristic ECG finding in atrioventricular nodal reentrant tachycardia, AVNRT? A. Regular narrow QRS complexes. B. Irregular wide QRS complexes. C. Regular wide QRS complexes. D. Irregular narrow QRS complexes. Answer: A. Regular narrow QRS complexes. Explanation: AVNRT is characterized by regular narrow QRS complexes on an ECG, as the reentry circuit typically involves the AV node and atria, leading to rapid but coordinated ventricular contractions. Which maneuver is often used to terminate an episode of PSVT? A. Carotid sinus massage. B. Valsalva maneuver. C. Deep breathing. D. Holding the breath. Answer: B. Valsalva maneuver. Explanation: the Valsalva maneuver is often used to terminate an episode of PSVT by increasing vagal tone, which can slow down AV nodal conduction and interrupt the reentrant circuit, causing the tachycardia. Which of the following medications is typically first line for acute management of PSVT in the emergency setting? A. Digoxin. B. Adenosine. C. Amiodarone. D. Beta blockers. Answer: B. Adenosine. Explanation: adenosine is typically the first-line medication for the acute management of PSVT in the emergency setting due to its ability to temporarily block AV nodal conduction, which can terminate reentrant tachycardias. Which type of paroxysmal tachycardia involves an accessory pathway that can conduct impulses from the atria to the ventricles? A. Atrial fibrillation. B. AVNRT. C. Wolff-Parkinson-White (WPW) syndrome. D. Multifocal atrial tachycardia. Answer: C. Wolff-Parkinson-White (WPW) syndrome. Explanation: WPW syndrome involves an accessory pathway, the bundle of Kent, that can conduct impulses directly from the atria to the ventricles, bypassing the AV node and leading to episodes of paroxysmal tachycardia. What is the hallmark ECG finding in WPW syndrome during sinus rhythm? A. Wide QRS complexes. B. Short PR interval with a delta wave. C. Prolonged QT interval. D. Peaked T waves. Answer: B. Short PR interval with a delta wave. Explanation: the hallmark ECG finding in WPW syndrome during sinus rhythm is a short PR interval with a delta wave, which represents early ventricular depolarization through the accessory pathway. Which of the following is a common symptom of paroxysmal tachycardia? A. Gradual onset of palpitations. B. Sudden onset and termination of palpitations. C. Constant chest pain. D. Persistent fatigue. Answer: B. Sudden onset and termination of palpitations. Explanation: paroxysmal tachycardia is characterized by the sudden onset and termination of palpitations, as the arrhythmia begins and ends abruptly. Which diagnostic tool is most useful for documenting episodes of paroxysmal tachycardia in patients with infrequent symptoms? A. Standard 12-lead ECG. B. Holter monitor. C. Event recorder. D. Echocardiogram. Answer: C. Event recorder. Explanation: an event recorder is most useful for documenting episodes of paroxysmal tachycardia in patients with infrequent symptoms, as it can be activated by the patient to record the ECG during symptomatic episodes. In the context of paroxysmal atrial tachycardia, PAT, what does the term paroxysmal refer to? A. Constant. B. Irregular. C. Sporadic and sudden onset. D. Gradual increase in heart rate. Answer: C. Sporadic and sudden onset. Explanation: the term paroxysmal refers to the sporadic and sudden onset and termination of the tachycardia episodes, distinguishing it from more constant forms of tachycardia. Which of the following conditions can predispose an individual to developing paroxysmal atrial tachycardia, PAT? A. Hypokalemia. B. Hypernatremia. C. Hypocalcemia. D. Hyperkalemia. Answer: A. Hypokalemia. Explanation: hypokalemia can predispose an individual to developing PAT due to the increased excitability of atrial myocardial cells, which can trigger abnormal electrical activity and tachycardia. What is the primary difference between AVNRT and AVRT, atrioventricular reentrant tachycardia, in terms of the reentrant circuit? A. AVNRT involves the AV node, while AVRT involves an accessory pathway. B. AVNRT involves an accessory pathway, while AVRT involves the AV node. C. AVNRT involves only the atria, while AVRT involves only the ventricles. D. AVNRT and AVRT involve the same reentrant circuit. Answer: A. AVNRT involves the AV node, while AVRT involves an accessory pathway. Explanation: AVNRT involves a reentrant circuit within or around the AV node, whereas AVRT involves a reentrant circuit that includes an accessory pathway connecting the atria and ventricles, such as in WPW syndrome. Which of the following is a potential long-term treatment option for patients with recurrent symptomatic PSVT? A. Radiofrequency catheter ablation. B. Long-term anticoagulation. C. Permanent pacemaker insertion. D. Heart transplantation. Answer: A. Radiofrequency catheter ablation. Explanation: radiofrequency catheter ablation is a potential long-term treatment option for patients with recurrent symptomatic PSVT, as it can definitively eliminate the reentrant circuit causing the tachycardia. Which class of antiarrhythmic drugs is commonly used for the prevention of recurrent PSVT? A. Class 1, sodium channel blockers. B. Class 2, beta blockers. C. Class 3, potassium channel blockers. D. Class 4, calcium channel blockers. Answer: D. Class 4, calcium channel blockers. Explanation: Class 4 antiarrhythmic drugs, calcium channel blockers, are commonly used for the prevention of recurrent PSVT, as they can slow AV nodal conduction and prevent reentrant circuits. Which feature on an ECG can help differentiate AVNRT from atrial flutter? A. Presence of P waves before each QRS complex. B. Regular narrow QRS complexes. C. Rapid atrial rate with sawtooth P waves. D. Irregular ventricular response. Answer: C. Rapid atrial rate with sawtooth P waves. Explanation: atrial flutter is characterized by a rapid atrial rate with sawtooth P waves on an ECG, whereas AVNRT typically shows regular narrow QRS complexes with P waves either not visible or occurring just after the QRS complex. Which symptom is least likely to be associated with paroxysmal tachycardia? A. Palpitations. B. Dizziness. C. Syncope. D. Persistent cough. Answer: D. Persistent cough. Explanation: persistent cough is least likely to be associated with paroxysmal tachycardia. Common symptoms of paroxysmal tachycardia include palpitations, dizziness, and syncope due to the sudden onset and rapid heart rate. Which of the following can be a trigger for paroxysmal atrial tachycardia, PAT? A. Alcohol consumption. B. High-fiber diet. C. Regular exercise. D. High salt intake. Answer: A. Alcohol consumption. Explanation: alcohol consumption can be a trigger for PAT due to its effects on the autonomic nervous system and myocardial excitability, which can induce episodes of tachycardia. What is the typical heart rate range for PSVT? A. 60 to 100 beats per minute. B. 100 to 150 beats per minute. C. 150 to 250 beats per minute. D. 250 to 350 beats per minute. Answer: C. 150 to 250 beats per minute. Explanation: the typical heart rate range for PSVT is 150 to 250 beats per minute. This rapid rate is a hallmark of the condition and is caused by the reentrant circuits within the heart. Which of the following is a common finding in patients with paroxysmal tachycardia during an episode? A. Bradycardia. B. Hypertension. C. Hypotension. D. Normal blood pressure. Answer: C. Hypotension. Explanation: hypotension can be a common finding in patients with paroxysmal tachycardia during an episode due to the rapid heart rate and inefficient cardiac output, which can lead to decreased blood pressure. This can result in symptoms such as lightheadedness, dizziness, or even syncope. Which of the following maneuvers can be performed by patients to potentially self-terminate an episode of paroxysmal tachycardia? A. Drinking a cold beverage. B. Lying down and resting. C. Splashing cold water on the face. D. Coughing forcefully. Answer: D. Coughing forcefully. Explanation: forceful coughing can increase intrathoracic pressure and stimulate the vagus nerve, potentially leading to termination of an episode of paroxysmal tachycardia by affecting the AV nodal conduction. What is the primary goal of treatment for patients with paroxysmal tachycardia? A. Normalizing blood pressure. B. Preventing recurrence of tachycardia episodes. C. Achieving sinus bradycardia. D. Inducing ventricular fibrillation. Answer: B. Preventing recurrence of tachycardia episodes. Explanation: the primary goal of treatment for patients with paroxysmal tachycardia is to prevent the recurrence of tachycardia episodes